great folks behind me that can help answer any questions you might have. I'm going to just go through the list of those folks right now. I'll be joined today by Georgia Department of Public Health Commissioner Kathleen Toomey, along with State Epidemiologist Sherry Dresnick, Insurance Commissioner General John King, General Tom Carden of the Georgia National Guard, our Adjunct General, the GEMA Director Homer Bryson, our State School Superintendent Richard Woods, State Senator Ben Watson, State Representative Sharon Cooper, Atlanta Airport General Manager John Selden, and Department of Public Safety Commissioner Colonel Gary Val. As you all are aware, last Monday we announced our first 2 confirmed cases in Georgia involving residents of Fulton County. We now have 6 confirmed cases of COVID-19 here in our state. There are 3 confirmed cases in Fulton County, with the first 2 cases involving 2 family members where the parent had recently traveled to Italy. Both are isolated at home with mild symptoms. The 3rd case in Fulton involves an individual who is currently hospitalized. The source of the infection is unknown at this time. 1 patient in Floyd County was confirmed earlier today to have COVID-19. This testing was done by LabCorp. The patient remains hospitalized and the source of infection is unknown at this time. 1 patient in Cobb County was confirmed to have COVID-19 on March the 7th. Testing was conducted by the CDC. This individual also recently traveled to Italy and is isolating at home with mild symptoms. A patient in Polk County was confirmed to have COVID-19 on March 7th. Initial testing was conducted by the state lab and confirmed by the CDC. This patient remains hospitalized. The source of the infection is unknown. We now have 7 presumptive positives pending confirmation. There are 2 in Cobb County, 1 in Cherokee County, 1 in Gwinnett County, and now 3 in Fulton County. Over the past few days, we've provided information on all of these cases except for 1, and I will go through that one now. Over the weekend, state health officials learned about a situation involving a South Korean individual now hospitalized in Fulton County. This person is exhibiting symptoms consistent with COVID-19, although testing results are still pending. It is unknown whether this individual was symptomatic when they boarded a flight from Incheon International Airport to Hartsfield-Jackson. Upon arrival at the airport, customs officials noticed that the passenger was displaying symptoms. The passenger was transferred to the CDC quarantine unit for further evaluation. That unit is at the airport and was then later transferred to a hospital. Overnight, state and hospital officials were able to secure a translator and arrange for the patient's transfer to an isolation location for monitoring by state health officials and contact tracing. Earlier, I spoke with federal officials about this case. They are already working to evaluate the system and to determine potential exposure. We've been informed that CDC officials are prepared to answer questions regarding this specific case, and we have been assured that federal officials will continue to provide us with updates as they become available. Late Saturday evening, my team received a briefing from our federal partners. We've learned that 34 Georgians, along with additional American citizens from the eastern United States who are currently aboard the Grand Princess cruise ship off the coast of California, would be transferred to Dobbins Air Reserve Base, where they'll undergo testing and be quarantined for possible exposure to COVID-19. In a few moments, Adjunct General Carden will be able to provide more details and updates on this new development. Earlier today, my office, along with the Department of Public Health, the Department of Public Safety, the Department of Natural Resources, began preparing Hard Labor State Park in Morgan County as a location for isolation and monitoring of patients who may have been exposed to COVID-19. Let me emphasize, this is only a precautionary measure. We have, however, identified a Cherokee County patient who has a presumptive positive test for coronavirus who may need to be transferred to that location. Right now, there are several emergency trailers ready for patient isolation. We are working on getting materials delivered as the need arises. We also have notified local officials in the area, and we deeply appreciate their support as we make these preparations. From the very beginning, we have promised to be transparent and to keep Georgians informed. That's why we're telling everyone now that the national message is starting to change, and we need the public to continue to follow important guidance. At noon today, my office participated in a conference call with Vice President Pence, federal officials, and governors for an update on national preparedness. Vice President Pence asked us to emphasize the following points. We all have to be vigilant for the health and safety of our elderly citizens and those with chronic underlying health conditions. They are at risk the most, and we all have a critical part to play in their health. If you're sick, do not go to work. Do not attend large events. You will put others at risk. If you're elderly or having underlying chronic conditions, avoid large events and stay away from loved ones and friends who are sick. In addition, federal officials are now urging these vulnerable populations to avoid travel to hot zones and to avoid cruise ship travel altogether. We are not yet advising the cancellation of large public events, but we are calling on Georgians to follow these revised guidelines to mitigate risk and keep people safe as possible. As the cases become more numerous across the country, we are definitely going to see more cases here in Georgia. Thanks to the efforts of countless hard-working officials across all levels of government, we are ready. Please continue to use these best practices that are being emphasized by federal, state, and local officials. Wash your hands, avoid contact with your face and eyes, and please stay home if you are sick. Get a flu shot so we lessen the amount of hospital beds used for flu when we may need them for the coronavirus. Like the common cold or flu, COVID-19 knows no cultural, racial, or community barriers. We have heard reports of those who have been stigmatized or singled out. As Georgians, that is not who we are. In this time of need, I'm asking Georgians to support their neighbor because we are all in this together. The last update I'll provide you is that we've heard that Fulton County Schools will close the district tomorrow due to a positive coronavirus test involving one of its teachers. While it is ultimately a local decision, we strongly encourage any district or school considering closure to first contact the Department of Public Health for guidance. School closures, as you all know, have a significant impact on student learning, employment, and other many issues in the local community. With that, I'm going to turn it over to Dr. Toomey for a brief update, who will be followed by General Carden, Insurance Commissioner King, State School Superintendent Woods, and finally, GEMA Director Homer Bryson. Dr. Toomey.
Thank you, Governor. Thank you, Governor. Thank you. I just wanted to mention a few quick things. Since we began testing in the State Public Health Lab, we've run about 50 or 60, tested about 50 or 60 individuals. We'll try to ramp up that capacity over the weeks ahead. We've already requested additional testing materials. What may be confusing is that we say these are presumptively positive, and that's because CDC hasn't given us the clear go-ahead that we can be the final word. We're hoping we will have that within a matter of days to weeks, and then there won't be a need for reconfirmation of that positive at CDC. So until that time comes, our lab will test positive. It'll be called a presumptive positive, and then be sent to CDC for confirmation. As the governor mentioned, we have 12 either confirmed or presumptive cases, and we expect those cases to increase. And this is not unexpected. We talked about that before. As we continue to increase our testing opportunities, we're going to see more and more individuals with this virus. What we're seeing as a pattern with our testing is it seems to have hit harder older people and those with chronic health conditions. And that's one of the reasons why the recommendation has come from the federal government, as well as the governor noted, that we need to ensure that we're protecting the older people in Georgia, as well as those with chronic health conditions. Advise them not to go out into crowds, keep themselves safe, but also if you're sick, don't go out and expose them. Even don't go out of the house necessarily to buy things that you need from the store. See if someone else can do that for you. We're trying to ensure that anyone who may be infected doesn't come in contact with others. The other messaging I wanted to say is we are very, very proud of the governor's leadership and what happened over the weekend with the cruise ship passengers, and that we will be having those cruise ship passengers come to Georgia to be housed at Dobbins. You'll hear more about that. I want to let you know proactively that 34 of those cruise ship passengers are actually Georgia residents, and that those residents will be monitored by us in public health in their homes, just as we have done routinely with other travelers who have been out of country and have then returned. And that will allow them to go back to their homes where they're comfortable, and we can do that monitoring through our existing system. And I think that, again, is the right thing to do. It's sending the right message. We have the capacity to take care of our Georgia residents, and I'm very happy to let people know that, because I've gotten numerous calls over the last several days about people whose relatives and friends are on that ship and coming home to Georgia. So just to close, once again, stay home if you're sick, and you're going to help us so much. Thank you very much.
Jim?
Sir. Good afternoon, everyone. We've been planning and training for the situations like we're facing today for many years. In the last few days, we've been working closely with our teammates at Dobbins Air Reserve Base as they prepare to receive evacuees from the Grand Princess cruise ship. I can assure you that the measures to support those evacuees while simultaneously protecting the public are well planned and synchronized. Our headquarters is co-located on the installation, and I have no concerns about going to work there each day. Based on Governor Kemp's guidance, we stand ready to provide additional support as required to our teammates at Dobbins and elsewhere across the state. Thank you very much.
I want to first thank Governor Kemp and the rest of the members of the task force for all the great work you've been doing on behalf of Georgians. We are ensuring that Georgia is prepared to respond effectively to this disease. Today, our department issued a directive to Georgia insurance industry meant to guarantee that no Georgia is denied testing or treatment related to coronavirus. Specifically, we're asking insurers to waive office, urgent care center, and emergency room copays for testing for the virus. We're also asking them to evaluate their provider network to ensure they can handle the potential increase in need for services related to COVID-19. For those insurers with networks that cannot meet this capacity, we're asking them to provide their members with access to out-of-network provider at in-network rates. Again, our number one priority is ensuring that there's no barrier for access for any Georgian who needs testing or treatment for this virus. In addition, we're encouraging the industry to begin reviewing their internal process and procedures to ensure that providing members with accurate information, access to medically necessary services, and prompt responses to coronavirus-related inquiries. This also includes reviewing their telemedicine policies and programs to ensure that they're able to meet increased demand associated with the virus. And lastly, we're asking insurers to share that information with us on the steps that are taken in response to today's directive. It is important both for state health officials and to the public at large to be fully informed throughout this process. I'm happy to report that even before releasing today's directive, We have already begun to hear from a number of insurance companies on the proactive steps that we are taking with the help with their members deal with this challenge. We hope to continue working closely with the industry throughout this process to ensure that we are all doing what we can to remove any potential barriers for the care of our citizens. I'm confident that all parties involved are committing to putting the people of Georgia first. Thank you.
Good afternoon. Again, I appreciate the help and support from all of our task force members, but specifically want to recognize Governor Kemp and Dr. Toomey and their staff for supporting us over the past several weeks. This is something we've been monitoring for a while now. Today, as has been mentioned, we have been in contact with Fulton County Schools and Superintendent Dr. Mike Loomy in concert with the Governor's Office and the Georgia Department of Public Health. Fulton County Schools has announced that all schools in their districts will be closed tomorrow. We support this decision and thank Superintendent Looney for his leadership, and will continue to be in contact with the district. We're advising all Georgia school districts to continue following the guidance of the Georgia Department of Public Health and their local boards of health. At this time, school closures are not recommended for any other districts. All school districts should continue to take preventative measures, including providing ample time for students and staff to wash their hands and developing plans to continue student learning should your school district need to be closed for several days. Parents, again, please keep your students at home if they are sick. Do not send them to school. Teach your children to wash their hands with soap and again water for 20 minutes or with water for 20 seconds, and to stay there stay at least 3 feet away from those who are sick. We would also encourage that if there are any staff members within the districts, that you need to stay home as well, so that we model the proper role in what we are trying to do in preventing the spread of the virus. Georgians can be confident that the safety of our schools is our first priority. Again, I wish to thank Governor Kemp for acting proactively to protect all Georgians. We will continue to work closely with him and Dr. Toomey to ensure that our schools have the most up-to-date information and resources and support regarding COVID-19. For anyone who is in the Fulton County School District, you may go to the Fulton County web page and you will see information provided there. Also, if you wish to go to the Georgia Department of Education, we also have a section which deals with coronavirus updates as well. Thank you very much.
Earlier this month, Governor Kemp issued a state of emergency for 120 counties in our state related to severe weather and flooding. As a result of that, we stood up the State Operations Center and began working to support our citizens and local communities in their time of need. That effort continues today, and the State Operations Center is still working to fulfill that mission. Beginning today, working with the Department of Public Health, we're looking at taking on additional responsibilities in the State Operations Center. We'll be right-sizing staffing, and we'll take the additional duties of supporting the Department of Public Health and other state and federal partners with the virus issue, and we are confident that we will help push out communications to the citizens and be more proactive with that, and we look forward to supporting them and the Governor's office with this effort.
All right, folks, so we'll do some questions. If you just raise your hand so everyone's not shouting out, we'll go around. Richard?
Governor, one question, and it's maybe a clarification. The 34 Georgians and others that are coming here to Dobbins, they're going to be quarantined at Dobbins, or I also heard Dr. Toomey say they're actually going to be sent home, where they will be, I guess, self-quarantined?
You want to speak?
Sure. Yeah, they will be transported to their homes, wherever those homes are. And I understand they're from all parts of the state. And then we will monitor them with our public health system, just in the same way that we monitored all the travelers from China and other places earlier. So they will be able to be in their homes. We will check in with them, our public health staff, both state staff and local staff in the public health districts. But this both ensures the safety of the public, but also gives them the comfort and support of being at home. So we're really pleased to be able to do for them what we did for so many other travelers returning back to Georgia.
And there are others coming from the East Coast as well. Are they going to be staying at Dobbins? Or
They'll be staying in Dobbins.
Do you know how many?
over.
General Carden, you
oh,
want to
yeah,
speak
I
to the
was gonna say.
bed capacity?
Yes, sir. Sir, Dobbins has a capacity right now of about 151 evacuees. We have additional space at the Clay National Guard Center of Dobbins that is available to Health and Human Services should they need it, up to about 190 beds. They've looked at those today and certified those as meeting their standards. So we have significant capacity over and above what we think we're going to have with the current numbers we're tracking.
And I would just add to that point, I think the reason they're bringing them into Dobbins, to the Air Force Base in Texas, and then 2 in California. Obviously, you're dealing with thousands of people that are on the cruise ship. Those are going to be the centralized locations at those facilities. The feds will handle all the wraparound services, meal, medical services. It's a one-stop shop on the base, and then as people are cleared to go, they'll be moved into their homes in Georgia or back to their other states, is what my understanding is.
Steve.
Dr. Toomey, can you talk a little bit about the incubation period for COVID-19 and why there have been some delays with some things, and why, for example, Congressman Collins is self-quarantining to make sure that there's nothing wrong?
I'm unaware of the situation with Congressman Collins, so I can't speak to that. But the incubation is 2 to 14 days, and I think in an abundance of caution because of the situation that he may be. But I'm not aware of that situation. I was doing other things, so thank you.
Andy.
What was, 2 questions, the significance of the South Korea case? Can you explain why that case is significant? Why it's...
Well, I mean, obviously it's significant because the person was coming through the Atlanta airport. You know, we've been getting a little bit of conflicting information. Obviously, this person doesn't speak English, so it's hard communicating with them. You know, we're running some more down. I will tell you that the CDC, I think, can answer more questions on that. They have taken over that because it was a foreign national.
The other question is about community spread. Is that something that you suspect is going on now? Is there any way to characterize that?
Okay. Yes, we would not say that there's sustained community spread or person-to-person spread, but I think based on the fact that we are seeing some cases that are not travel-related, we do feel strongly we need to take some precautions, particularly with those who are most at risk for complications of COVID-19. Those are the elderly, and those with chronic health conditions. But at the same time, I think we all need to take those personal precautions of washing hands, covering your cough, and please stay out of the office or other events if you know that you're sick.
Jeremy.
Governor, given the news about Representative Collins, you were around him on Friday when he was in town for the CDC event. How are you personally changing your behavior, operating, as well as your staff? You were there with the president when Collins was in town.
Well, I'll let Dr. Sherry Dresnick address that question, but for my personal behavior, I started that before session ever started, before I ever heard the word coronavirus. You know, it's always folks here at the Capitol getting flu, so I'm good about keeping my hands washed. I'm good about taking hand sanitizer with me, and we're good about telling people that they may not have a job again if they come to work when they're sick. And in fact, in the rest of the office, I'm obviously being facetious on that, but I mean, that is what we're telling people, because we know if you come here during session, people are working long hours, they're tired, they're susceptible to these things, and so we just have to all be very cognizant, and I'll let Dr. Dresnick address the Collins situation.
Although I don't know a lot of details about the situation, I will say that individuals that are not showing symptoms of COVID-19 disease do not pose a risk.
And Governor, are you experiencing any symptoms?
Only symptom I have is lack of sleep, but it's all right. We've got a great group of people that are working extremely hard right now, literally all weekend, to get as much information as we can to continue to push it out as quickly as we can, but we're being very careful as well, so we're not putting out misinformation. I cannot say enough about Dr. Toomey, Dr. Dresnick, the members of the task force, General Carden and everyone else who has been hunkered down all weekend working with our partners at the federal level for the situation at Dobbins and dealing with these other things. And I would just tell folks, look, the more we test, and this was something that the Vice President was talking about today on our call with, I believe there was about 42 governors on that call. The more testing that gets done, the more positives we're going to have. So we're going to continue to have more and more information that comes very, very fast. I could see where it probably is going to be even harder to keep up with the individual cases like we're doing now, but we are committed to continuing to be honest with the public so that they know, because they are on the first line of defense for this. And we want them to be informed.
The Governor, the coronavirus doesn't care whether you're on insurance or on Medicaid, but what plans are being made for the people who have neither kind of coverage?
Yeah, we spoke about that a little bit last week in the Vice President. Obviously, the uninsured part of I believe we can verify this fact, but I'm pretty sure that I'm safe in saying that part of the funding package that passed the Congress in record time will handle the testing for uninsured and care, I believe, as well. We can confirm that point later.
Governor Kemp, you mentioned 6 cases confirmed, 6 that are presumptive, correct, in terms of the COVID cases. You met with President Trump and the folks at CDC. What was President Trump's response to how Georgia is handling this in terms of vaccines and how Georgia is handling COVID-19?
I think he was pleased with what he saw Friday. I mean, I was too. I mentioned how hard our public health officials are working. I can tell you they are working just as hard at the CDC. I've been on several calls and been with Dr. Redfield multiple times, Secretary Azar. We've been on with Homeland Security people. Just their whole team has been so accessible. I've spoken with the Vice President several times as well. They are very appreciative of the state's efforts, and I quite honestly am very appreciative to the accessibility that we've had to the administration to keep relaying things up and getting literally 24/7 response from them.
And Governor, the isolation site at the hard labor site, could you give a little more details about that? Like when that will be ready, who would qualify to go there as opposed to being kept in your home, and how many people might be able to?
Let me let Homer speak to the readiness. I think you probably can answer that better than anyone, and then we can get to the second part.
The Department of Public Health owns 7 travel trailers. They were purchased with the intent of this in mind. Years past with other events, we've partnered with the Department of Natural Resources and had them as a backup to use them and these trailers. We didn't have to do it then. We made those arrangements several weeks ago with the department. We asked them to look at their parks and see which areas they felt most comfortable with doing this and standing the trailers up. They chose the park because of location and because of the layout of the park. We can isolate those trailers from the rest of the park and visitors at the park. We delivered, all of those trailers have been delivered to the park, and all of those trailers are open and operational now if they're needed.
And just a little addendum on that is that there are many times as we're dealing with individuals, they may not have a home environment which is conducive for home monitoring for whatever reason. They may not be from Georgia, they may be passing through. There may be a foreign national who may be identified. Then we need to find an alternative location to house them. You can't be, particularly if an individual has the infection, you can't put them in a hotel or a public place. So you need to have a place that's off-site where our staff can provide the services for them. We may remember that the private labs, now Quest and LabCorp, have begun testing, and we've already had some reports of positive tests that have come back, done by physicians. We will continue to work with those physicians to identify individuals and do appropriate placement for them as necessary. So not just from our own laboratory, but also with private physicians and private labs as well. And so we may see increased need as the time comes, depending on whether we identify individuals without a home environment for home monitoring.
All right, well, thank y'all. We have some folks that have to get to things. I know we covered a lot of topics. Everyone has my email. If you have questions, please just email me. I'll try to get them to you to answer as soon as we can. Thank you.